Welcome back to Uncharted Narratives. Today's episode is about self-discovery, reinvention, and having the courage to follow your own definition of success. My guest, Jules McDonald, has been a nurse since she was 18, and her journey has taken her from oncology wards to fertility clinics, and from her home country to Abu Dhabi, where she now works in IVF. Along the way, personal family experiences, moments of doubt, and big career pivots pushed her to ask hard questions. What kind of nurse do I want to be? Where do I feel most alive? When is it time to leave and grow? Those questions led her to fertility nursing, to writing a book for patients, and to building a life and career that feel aligned with her values, not just her job title. In this conversation, we explore how Jules listened to her own instincts, navigated cultural shifts, let go of roles that no longer fit, and turned her experience into something that supports others on their most vulnerable journeys. If you're standing at a crossroads in your career or life and wondering what it means to follow your own version of success, this episode is for you.
Hello, nice
How
to
is it
see you.
going?
And very good, thank you. How was your day?
It is night in your time. You are in Dubai or Abu Dhabi?
Yes, I'm in Abu Dhabi,
Abu
PM.
Abu
Abu
Dhabi.
Dhabi.
Abu
Yes.
Dhabi. Do you speak Arabic or understand anything in Arabic?
I can say about 5 words, which get me through with inshallah and shukran and bukra. But I contacted someone yesterday for lessons. Like I have to. I want to be able to communicate.
It's
So, and I owe it to where I'm living and all the population to really
yeah,
communicate and understand.
but yeah, Bukra, I like it from you how you said Bukra. And now I start to realize, inshallah, it is not
Yalla
a report.
habibi.
Hal Habibi, come to Dubai. Yeah, it's been a while. You are in Emirates and in Arab areas, right?
Yes, I'm coming up to 3 years now. So I wanted to live here with my husband for many years. Always thought about living in Dubai. And then when I got the job offer in Abu Dhabi, I was like, where's Abu Dhabi? Hadn't really known much about it. So now I
This
realize Abu Dhabi is the best.
Yeah. This is the Western
Everyone
stereotype.
knows
It's
Dubai.
okay.
Yeah.
Okay, Jules, I would like to give me a quick intro who you are, and I'm very excited for today. There's too many questions prepared for you.
So yes, I'm Jules McDonald. I am a nurse. I have been a nurse since I was obviously 18 years old. I'm currently the director of clinical operations for Art Fertility Group, which is now part of the IVRMA. I have a son who is 7, my miracle IVF baby, and a 26-year-old stepson. And I live with my husband here. So yeah, doing well.
Doing well, thank you. So I think we will touch base about your miracle son. This is something new for me. I don't know, and it's part
Yeah.
from your own business. So when
Yeah.
I came to your profile and we've been connected for a time, but in LinkedIn we connect what we don't have that genuine conversation. I see this is not the right way. So when I started to connect with you and speak with you, I see your inspiring journey. So I got confused. You are Australian, but you work
Yes.
on UK, then moved to Abu Dhabi, right?
Apologies. Yes, I am an Australian that has lived in England for 18 years before coming here. So yes,
Okay. But you studied
both.
in Australia and you moved to UK to work there, right? As a nurse.
Yes. So I studied at Sydney University, and then I worked in Sydney for a few years, and I worked in oncology, and then I came over to the UK and lived all around the country, working in kind of every different area possible. But yeah, ended
but
up
you
in
lived there.
fertility.
So yeah, is there any reason why you don't start your career in Australia and Sydney, but you go and started with the England and with the energy?
Everyone from Australia has to go and live in the UK. It's a rite of passage. Everybody goes either traveling around Europe or living in London. So I traveled Europe and then went and lived in London. So it's what you have to do because Australia feels so far away from everything. So it's so exciting to want to
work there. So also I interviewed a doctor. She is a Britain, but she when started to make her residency, she go for the Australia. So it seems there is a swap agreement
Yes,
between the both country.
completely. Well, the hospitals are full of Irish and or any British nurse, so yeah, it's definitely a swap
Okay,
happening.
so this is something interesting, and every time, everyone, when I met them with the nursing background, they have their own unique journey. So what I found it interesting and interesting in your journey, you don't stuck in the bedside, but it seemed from for me as an outsider, from the first day, you have a clear plan what you want to do. And that's become crystal clear when I just start the chat with you. One of those plans to go for Dubai. So that was a clear, and the destiny is take you for Abu Dhabi. So tell me a little bit how you decided to start nursing and why you choose IVF in particular.
So nursing, when I look back now, I remember being a young girl and always caring for everybody, and there was that nature of wanting to help. So that was always there. It wasn't until I was in my final year and I was thinking about what to do that nursing kind of came up. It wasn't that I at that point wanted to be a nurse. It was kind of like, okay, I'm going to finish school soon. What should I do? In Australia, you have the uni book and you have all the schools you need to get for all the universities. And I was drawn to Sydney University because in my eyes, it was the best university that you could go to. There's a funny story. Actually, the scores to get into this nursing course were quite high for nursing because it didn't need such high scores like a physio or a doctor, but at this university, it required really high scores. And I was so determined to get into this university that the open day, I drove 5.5, 6 hours straight to meet the dean of the university and sat with her on the open day and told her I had driven this far to meet her. And she said to me, based on your determination, it doesn't matter what your score is at the end of year 12, you'll get into
Wow.
this university. I know. So I was like, now I think back and I think, well, that proves that hard work and determination can get you places that, scores may not. So that was a great story. And studied there. I thought I wanted to do oncology because my uncle, when I was in my first year of university, he got a tumor and my family and I helped him through his death. And I remember just being part of that world. And I was like, okay, this is where I want to be. I just find the science of behind the oncology side of things, to be quite, the miracle of life, being able to help people. And in some cases, obviously not help people. And then the following year, my sister also got breast cancer when she was 23. So we lived together in Sydney. And so it was just a natural thing that I was going to do oncology and ended up working in oncology and then wanted to live in London. But living in London, it was kind of like you just go and become an agency nurse and you work anywhere you're sent and do anything. So, which was a good ground to kind of try everything and really that's where I built, which I found is helpful now, is how you build relationships. Essentially, you're going somewhere different all the time, meeting new people, and you have to connect with your colleagues because ultimately, you're dealing with life and death and working in A&E in different areas. So I found that to be I loved the variation of the role of working in an agency. But then I realized that I have to pick somewhere that I want to be. And I saw a job for a trainee fertility nurse. And at the time, my sister, who had been through cancer, but was well and had married her husband, they were going through fertility problems. And so the job was a trainee fertility nurse. And I was like, I only just learned what fertility kind of was meaning in that respect. So went for this job and yeah, just unbelievable. Like to then not realize that I was going to work in the top clinic in London and work for a pioneer in the area of reproductive medicine. And what I learned and growing in that industry as well and working from a trainee to senior nurse and then manager and then moving up to ultimately working with the medical director and running the clinic, which was just amazing. From there, it was kind of like, okay, I'm working for the best in the country. And I have done this job now, and I'd been doing it for many, many years. And I knew I was at a certain age. I had to challenge myself. I have to push myself out of my comfort zone. And coming from Australia, the idea was coming to Dubai would be closer to Australia. So it would be a nice transition to kind of be closer to home and things like that. And the journey since then has been, my gosh, I have learned so much. I have been challenged more than I could ever imagine, put myself out of my comfort zone and going through imposter syndrome, all these things that like I'd never kind of, I guess, experienced before. But the foundation of, being a nurse has helped me to connect with people because again, on any business level, it's communication and relationships that is the most important thing. It doesn't mean I don't miss being with patients. I think, being away from not being on the bedside, I do miss that. And I have all these visions one day of when I'm older and I'm retired, like still working a few shifts a week just to kind of be with people because I do love that side of things. But on the flip side, to be able to grow your career and end up in these areas, like I love being able to kind of tell anyone that's not sure what to do to become a nurse because I think you really can go in any direction. And yeah, so currently I'm looking after we're opening up 2 clinics soon. So I'll be looking after 5 fertility clinics and looking, it's not just nursing, obviously, it's marketing and business development and all aspects of the business and, pulling in what I do know and helping and being part of the team. So yeah, it's going well. Very exciting.
It is too much for me to capture all those because everything you mention, it's something I am very interesting to dive in more and discuss. But because I don't want to forget one important point you have mentioned here. When you graduated from the high school, you take the decision to drove 5 hour and you go and meet the team because you are the chairman, you want this city. At that time, you are still young, fresh. I will not see you are very social competent, but what you have mentioned, you don't left your destiny for whatever it's come for you. You try to do your own best and it's worked for you because everyone we keep saying this will not work. I need network, I need connection, I need referral, I need for you, you know no one and you make it
Mhm.
by this way. So this is very
Yeah.
interesting message for everyone. Do your own best. You don't know how it will come. Right now you see because this 5 hour you are here sitting in front of me telling me you are opening an additional 2 clinic. So if you don't drop that
Yeah.
time,
Yeah. Yes. Yes.
interesting. Yeah,
Yes.
it's lovely when you see a throwback our story and our memory. That's one of the very important messages I want to. I would like to take this platform every time to bring a leader like you to listen for their story, also discuss very harsh topic on the healthcare system, and try to give a fresh perspective for decision maker, and at the same time to be really inspiring for a new generation. Not give them fake dopamine, not just motivate them, give them a real story how you moved from, as you mentioned, from your comfort zone, you imposter syndrome
Mhm.
was there, and you manage it in a very well, a good way. Before I move there in the next question,
I wouldn't
I would
say a
like,
good way, but I'm doing it.
yeah, you for sure there is up and down, and
Yes.
without those down, you will
Yes.
not
Yes.
appreciated
Oh
the
my
up
God.
which you have it,
Yes.
and this is the
Yes.
nature of the life. And
Yes.
it seems all around you there is a good story, unfortunately, where they are sick and they need your support as a part, as a member of the family. And the same time, this is it direct you to know this is the career I want. And I hope your sister feeling right now it's good and she is have a good health. But it seems she is the best one get benefit and advantage from you. So
Yes.
you are help her in her journey with the cancer and also with the fertility, and those also shape you with your career as
Yes.
well.
Yes.
Also, you have mentioned you are happy and you encourage everyone to be in the nursing career because there's more door to open, more opportunity is not only the bedside. And I can tell the way how every time I meet you and talk with you, and if I go for your profile, first of all, you are proud being a nurse. You
Mm-hmm.
telling me from time to time you try to take shifts to do in order to be close from the nurses. But there's no stereotype as a nurse who are in the scrub with messy hair. You
Which,
are all the time
yeah, I still
formal.
have scrubs. I still want to put
Yeah,
scrubs on every so often. I
but
need to
what
feel that energy.
what I meant the way how you present yourself for the public, the elite ladies with the formal and with the jacket, with the makeup, like a businesswoman. So this is where we need to try to change the stereotype. Unfortunately, and this is something some of with intention or without, there is a direction when you are working in the bedside, whatever your career or your profession, you are lost it, you are depressed, you are desperate. But this is not
Yes.
necessarily the case. This is the inspiration where you take the big problem and take it outside and open a business or innovate a new solution, whatever it's take from there. And this is where you can take your environment to help you to grow and also save your patient. But the way how it's label it and package it, every time you are not good in it if you are in the bedside, which is not right. You are an example. You are right now. You just told me before we started shooting. Just come back from your work. So this is day to day how you work. This is how you look. You're looking great.
Yes. Well, I think you like to put your best foot forward, and I mean, I have a uniform. At the end of the day, I'm going to, I wear certain outfits, so I'm still used to wearing a uniform, and I find that like creating a uniform out of different suits is essentially what people do, don't they? Because it makes life easier.
It is not
But yeah,
not. It's not my point here is not the uniform. The mindset. The mindset.
mm,
You see everything as an opportunity.
yes,
Uniform is part from the career, and this is for sterilization and also how to be close with our patient and keep them safe. The issue,
hmm
how you present yourself outside of uniform. You are very successful women. You see the opportunity right now in the platform. You are trying to hire a new staff for your clinic. So this is the energy and
yes,
the mindset which I'm looking for that. So there is no harm
yes,
with the scrum. I am feeling very sad because I don't have too much or too many a picture for me when I was a nurse with the scrub in that time, and I
yeah.
feel
Me too. I don't have
yeah,
enough.
I don't have enough. I see this is very bad. So I want to take this further and try to take your journey while you are working and you started to decided you want to go for the fertility. One of those factors help you to choose the fertility in the training. It's your sister. Any other factor help you to decide? Listen, after all those experiences I had here and there, I want to be with the fertility. Is there is any philosophy or principle it drove you to take this decision?
I will be honest that one of the things was that it's not in a hospital. So I think a lot of nurses get to the point where they don't want to do night shifts anymore as well. It was in a really, well respected part of London. I felt like after doing the research and understanding that this area was so it was growing so fast and there's so many innovations. And I thought, yeah, something came to me. I just thought this feels like a very exciting area to be part of. And also, I had worked with death a lot in terms of working in oncology. So then it's nice to bring life, and it's the complete other end of the circle of life. So it was a nice way to kind of try something different. And yeah, I mean, that was the main reason was my sister as well, just to kind of because I felt like I could be
Absolutely.
part of the journey.
I work in the ICU and totally understand after certain time you feel very exhausted,
Yeah.
burn out, emotionally exhausted. You cannot tolerate
Yes.
anymore for death.
Yes.
And working in fertility clinic and focus on the IVF, this is where you bring the life, which you mentioned. And when you started as a miracle. So that it's really a good way. You not take it only that like this is still nursing DNA. You have it. You wrote a book about every single patient about their journey. Yesterday, I was
Yes.
reading some of the take messages from your book, and I found it is very interesting how nurse is nurse. Still, you try to advocate, help them, let them know how their journey, how they will go. And this is a new book. It's happened last year. You wrote it, right?
Yes, we released it a year ago. We self-published on Amazon, and now it has been picked up by Bloomsbury, which is the UK's biggest publishing house, and we are going to be releasing it again on 30th of July. So we're currently working with the editors now, and we're basically rewriting it, which the structure's there, but we're having to really put a lot of work into it because obviously you're dealing with professionals that linking every line and making sure it makes sense for the reader. And oh my gosh, I'm so grateful for this experience because it's such a better book. I mean, we loved the book before, but now it's really helping a lot more people. And they made us kind of think outside of just IVF and kind of think about more fertility, how to get
Mm.
pregnant and every step along the way. So we've really kind of broadened who we can help with this. And the title's been changed. We're just going through with the book design process now. So I said to my co-author the other day, I honestly, not I don't care, but the outcome, whatever it will be, just going through this experience is such a cool experience to go through and dealing with, the professionals we are. And my son, who gets my attention every time I'm at home, no matter what time of the day, whenever I'm at home, he's got my attention. And this is the first time in his life that he hasn't had my attention for, there's been weekends and nights where I'm busy, and he's like, "Why do you have to write a book?" And I said, "I want you to be proud of me for helping people. And if I can help one person have one of you, this is the best thing I can do." And I do want to advocate for patients because I do think this is such a hard area to get your head around, and understanding what the doctors are talking about and what you should do and what you shouldn't do. So it started off initially as like a best friend's guide. I wanted to be that person's best friend who may not tell anyone they're going through this. So that's when I approached Louise, who is a psychologist, and she had interest as well in doing something like this. So it came together like that. And it's just, yeah, it's going to be really
I like
lovely
the
to kind of
combination.
release it.
I thought Dr. Lewis she is in gynecology, but it's psychology, and here
Yes.
it is built on science and real experience from the nurse who know
Yes.
the journey, and also from the psychology how do you support them. But interesting here, this is a very hectic and painful for your patient, so they need someone or something to be a guidance for them and help them down the road, down the journey. So you decided that,
Yes.
but you decided to write a book. And we are at 2025 right now. If this is happening, it is really a problem. They thought about having a mobile app or something powered by AI to help them with the journey. No, you are a traditional way. You wrote a book. So what is your philosophy from here? Why you choose not to go? However, you are very innovative and you like innovation, but when it's coming for the patient, you take the old journey or the traditional journey for writing. Can you tell me why?
Because initially I went to a bookstore in Abu Dhabi and was looking in the book section for fertility, and it was about this big. There was about 10 books. That was it. And then I looked over and there was the self-help area, which was thousands of books. And I thought, this is not fair. If 1 in 7 couples have a fertility issue, there needs to be a lot more material available for people. And that was why. And then I looked at who had written the books. Now, a lot of them have been written by patients, and a lot of them have been written by medical professionals. But both my colleague and I, who wrote the book, co-author, we've both done IVF, and we both have, worked in the field. So we kind of bring both aspects. You can read, once you've been a patient, you can come at it a different way. And also just I mean, I like reading books, and especially self-help books and things like that. So I think I'm very old-fashioned in that way. And an app for me, of course, there's been conversations with people where they want to do things. And in the future, I'm sure at some point we will look into the future of digital ways, but definitely the old-fashioned way of a book is the best thing. And then a patient can flick through because it's broken up in different chapters of the journey. So maybe they're not at that stage yet. So they can just pick it up whenever they need to kind of get some inspirational support. And there's lots of practical tips in terms of, especially the psychology side of how to do this. And, my one big tip in the book is, if you're going into a doctor's appointment, always ask the question, what would you do if I was your sister? What would you do if I was your daughter? So making it personal. So those little tips for people that can hopefully help them through this.
I didn't read your book, but isn't the book like a checklist or what kind of the question I need to ask my doctor? Something I guidance or just telling the story and let them to understand their emotion and what they feel?
It's broken up into many factors. So yes, it's across the whole journey from understanding your hormones, because most women, and especially all the nurses that I employed in the clinic, everyone joined as a nurse and nobody knew the female hormones and how they worked. And so that was the first job of any nurse, was like, learn the hormones and then we'll move forward from there. So teaching women to understand their bodies and what's happening through the cycle, and that basic thing, which for a lot of patients, they didn't even understand exactly when the right time to try to get pregnant was. So
Yeah.
there were people going for IVF that hadn't probably tried properly, which is not everybody, but there were some people that once you kind of explained ovulation and when that was happening, you could tell that they weren't really sure about that. And that's fair, because people are not educated enough in this, and we don't teach it enough in schools, and there's a lot of misinformation out there about how to get pregnant. So there are checklists, there are questions, there are practical support, there are meditations, there's different things, diet and that, but there's also general information. And we do share our stories, which in the first book that's released, we didn't discuss anything about ourselves. And in the second time, we thought, well, we give case studies, and we thought we should talk about ourselves. So
Yeah.
we both shared our stories in the second rewrite, which was
And this is the
really good.
reason why you named the book "If Only I Knew."
So because everybody does say, if only I knew ... whatever it
Oh,
is about fertility, but they've actually changed it's not called If Only I Knew now, it's now called The Radically Honest Guide to Fertility Treatment. So it's that part of
it's like now a new book.
a completely different book.
You bring like a book with a new spirit, with a new structure, with more insight there, right?
So the title is now not called If Only I Knew. It's just called The Radically Honest Guide to Fertility Treatment, because they felt that If Only I Knew is used in quite a lot of books that are actually out there. So if you go onto Amazon,
Right.
it's not unique. And also The Radically Honest became quite a striking title in terms of, catching the eye of the reader. So yeah, the cover looks, again, they've gone for one that can really stand out in the bookstore, which is just like, even hearing someone say a bookstore, something I've written, just doesn't even, make sense in my head that I've done this, or we've done this, apologies. So it's very exciting.
Okay, so that's interesting. I'm very excited to see the new
Thank
book, the new version. However, I like that the cover page. It's look very
you.
attractive for the eye. When I try to find the book, yes, I realized this is too many books in have the same name. And then when I do further research, I found the book and the color. It's interesting. I think it's orange. I'm not sure if this is was orange. We as a man.
So actually, it's kind of like, I would say, like a salmony pink and red, like tones. But
Yeah.
actually, yeah, we have actually gone for an orange cover with the new one, because they felt
Yeah.
that this team of 50 people came together and have, discussed market research and what they think. So it will be an actual orange cover. And I did mention to the editor, which I didn't realize, that orange is the color of fertility. So it's meant to
Mm.
be. So it's going to be a very bright orange. Yeah.
And do you have any specific population or patient you are focusing for that? What I meant from this, because right now you are in Abu Dhabi. So is this
Mhm.
is communicated with your patient, the Arab community and society, or anyone?
So yeah, good question actually, because it was specifically asked that it was marketed towards the UK community in
Mm.
terms of the references that we used and the support services and different things. So it is geared up for that. But in terms of the actual contract we could be everywhere, but I don't have in the deal the UAE and America are not included. So at the moment, it's not geared up for here, but I have written it away and discussed parts where it can be brought here and it can be translated into Arabic, and it will be able to help, because at the end of the day, it doesn't matter where you live. This is the same problem for a lot of people.
And I'm assuming you have involvement with your previous patient to take their story and how they felt. That give me the question if this is right, correct?
Yes, yes, yes.
Yeah. So you are still connected with your patient till now after you left the UK, and still you have a relation with them, and where they also supporting you to do that.
Oh,
So
so
the
much.
the
Yes.
key here is not the book. How you maintain this relation to stay connected with your patient and build this relationship to share knowledge, experience, and also all those contact information to stay keep on touch with them.
I think Instagram is definitely the key, because the amount of people that follow me that were previous patients. And when I said that, when we said we were writing this book, the support that was received and the amount of people that commented and said the most amazing things. I mean, if I'm ever having a bad day, all I have to do is go and read one of my posts and read the comments. And I cannot believe the kindness, because you don't, like, medical professionals, or especially nurses, don't always realize the impact of that moment with that patient and what it means. And it's not until, these patients some didn't have children and some did, and then they contact you, they find you on Instagram, and then they'll remind you that you called them 10 years ago and told them they were pregnant, and they will never forget you. And some of them, unfortunately, you can't remember everybody. I do remember most people, but I just think, oh my gosh, like, what an amazing moment to be part of their life. So the connections I made all those years, and then maintaining that through Instagram, is the way that I'm connecting with patients and still communicating. And
Yeah, keep going, because I feel it's very touchy for me. How I never thought about it. So I know every time a nurse we keep mention as a healthcare professional, we need to maintain our every time when we discuss why we need to be on the social media and think about our image, our digital identity, and to be authentic and all of those things, especially on the LinkedIn. So
Mhm.
right now, it is the first perspective for me where your patient following you is not. Most of the time, we think about our client as open agency or open consultancy firm, all those things, or looking for the recruiter media sometime to be a guest on one of those podcasts or TV show. But what I hear from you, this is first time I think about it. Your patient following you and keep in touch with you. Is because very intimate relation, because this is for fertility, or this is normal with any nurse? The patient will go and check about her.
No, no, no. It's definitely, I would say it's definitely not normal. One thing about fertility is, patients are not unwell. So we all know as nurses that you have a duty of care, that you are seen, that they're often seen as vulnerable, and you don't take gifts, and you shouldn't be in any position where you're seen as, I guess, superior, or there's a way of abusing them in the wrong way, if that's the right word. So I always found that with fertility, they're not unwell, choosing to come for this treatment to help them have a child. And yes, whether we call it a disease or not, it's not labeled that yet, but there is something that is wrong with patients. But I would say they're not vulnerable in that respect. So you're helping them, they're well, and it's a journey, and your job is to guide them through that. So once you leave somewhere, like, you shouldn't have very, very close relationships with any patient. We all know that as nurses. But I found that because you've ended up becoming like part of the family with some people, because you'd worked with them for so many years, and been with them at these amazing times, like, you're one of the first people they want to tell they've had the baby, like, you're connected to them. So often once you leave, that's when the relationships will build. So I left that clinic, so I'm able
Mm,
to have a lot of patients that are still now, you know, connections. Whereas
mm.
in the nursing world, I suppose this is not a normal process. And yeah, so
It
yeah, I'm
makes
not
sense.
sure.
And right now, I didn't check your Instagram because I'm not active there. But your content is more entertainment or education for the patients right now. What you are doing in the Instagram?
No, I wouldn't say it's educational. I would say it's very much just me, and my family, and kind of, and that. So I find that, like, yeah, that's what I need to do and I want to do more of. And I even contacted someone today about filming some reels and different things, because there is so much information I want to share,
Yeah.
which we will share in the book. But it's like, there's no reason why you can't kind of share parts of that now. So I
Abs-
will be doing things like that.
Absolutely. I think I'm enough with the fertility and IVF. It's now
Yeah.
crystal clear what we have. But I would like to help us to see you as a nurse, how you evolve from and the growth from staff nurse, playing in different departments until you decided this is the area which I want because I need to stay away from the hospital and work with miracle and bring life, not bring death. So that's the crystal clear. Okay. but you keep growing. You start to think about business, you start to communicate about market strategy and market needs, and working with the marketer and working on opening a new business. And so that the leadership is not only a title for you, like what you grow, it is something really you pay from your pocket. So you are a real leader. If you are not, you will lose your own money. But it's looked like you are growing with something very fascinating, and I like that. And in the same time, you wrote your book and you improve your book for the next version and open business, and you have a family, and you tell me what is your secret sauce?
I do think that hard work is obviously the main key. I think no matter what job I've had, I've always just given my absolute all. And that person that would stay late or that person that would come early, and never I would never not give 100%. And I feel that that was every single day of my career, if I'm honest. And it's just who I am as a person. And maybe being a Tory, and I'm not sure what it is. Even in, there was a period where I was working for a recruitment agency as well. And I don't know if this leader aspects of me, but I do find that in short periods, I would kind of move up, and not that I was ever driven in that respect. It was just that I guess I have a bit of a bossy personality and I like things to be organized, and maybe just by chance I start leading, even, supporting the leaders, but doing what I need to do. I did kind of find in most of my jobs, I did rise quite quickly. And I think that that is, I'm the middle daughter. Maybe I needed to be heard a lot. And there were certain characteristics of me that helped me as a nurse to then become a nursing leader in whatever area I was working in. And I do think that that is hard work and always treating people with the respect that they deserve. I think that I see a lot of leaders who still treat people on lower levels in a different way, or not kind in how they actually communicate with people. And I'm finding that a lot of people don't hear positive things about themselves. So I'm definitely someone as well that likes to encourage and support and train and help. And I want everyone to succeed and I want everyone to grow. And I think that, you show your team how to work hard, and you will get a team that works hard with you by your side, which is nice. So I'm not sure where I was going with this.
So let me ask you here just to help you to reach for the point. Right now, what I see, you are growing, and that give you more pressure, burden in your life with your family, and also
Yes.
taking from your lifestyle, from your family time. But
Mhm.
you translate this for positive and try to see the opportunity.
Mhm.
Everyone have up and down in his
Mhm.
or her life.
Mhm.
I'm asking here why, what keep you motivated and up with all those challenges and think about the future and not think about like most of the, let's say, unmotivated after a few years on the hospital, they become burnt out. They become
Mhm.
frustrated from what they saw in the
Mhm.
hospital and the toxic environment and all the things, and they
Mhm.
start to decide when I will be retired and sit in the home.
Mm.
You
Yes.
take all those challenge and start to build your own future. My question here first, how you make it? I know it's very hard to answer. It's not, as I mentioned, it's not secret sauce. This is something it came with the experience. But let me know from your perspective how and what keep you motivated up to now. Because every time you grow with your ladder and jump the ladder, more challenge you will have.
Yes.
So you, yeah.
Yes.
So tell me how you decided. No, I will not count the time until I be retired and sit in the home. No, I will keep myself engaged, motivated, and also productive until last day of my life.
So I do find that going through the experience I went through last year of losing my job, which was a very, very, very difficult time because I had been defined as my job and defined as a nurse or in any title until that point. And then to lose that, I remember just sitting back and thinking, like, what do I want now? And also thinking, I'm at an age where you have to go for it now. I mean, if there's a chance to grow and learn and challenge myself, then this is the time. And I also sat back at that time and thought what I had been through, what I had learned, and where I had got to. So coming into the new job with everything I'd learned and realizing that there's not so much to be scared of. The imposter syndrome was completely gone. And I was able to put everything I'd learned and realizing that this is exciting because I, again, am learning more things and I can see, I achieved something the other day, which I said to my husband, this was something I've never done. I've been there 3 months, and the fact that I got over this challenge and I helped us succeed to another level in something we had been trying as a clinic for a few years. I was so proud because I thought this is again just putting yourself out there. Like I said about, learning Arabic, like I have to learn, I have to grow, I have to challenge myself. And I also want to inspire my son to show him that hard work and learning and all of this are the keys to kind of getting to the next stage. And I'm someone that also appreciates downtime. So I'm good at kind of going really hard and really fast when I need to. And then on my, weekends and that, I'm 100% the opposite and I will switch off and I will be all about self-care and relaxation and that because I know that there's both ways. But the motivation to grow and challenge myself at this age. And I know that, God willing, I can live till 80. I will look back and say, look at those years, what I was able to do and to be able to tell the story of what I was doing. And, at the moment we're building or designing a 7-star fertility clinic, which is kind of unheard of in the world. And I said to my colleagues today, imagine being able to say we're part of this. Like, how cool is this? And so I think it's just the constant strive to do your best. And I think one thing I always found was even through all the last few years, no matter how difficult the day was, just getting up, putting on my makeup, putting on my suit and just going for it every day. And if you do the best you can in that respect, then it does tend to follow that, you will be okay if you can kind of put the mask on and you're going to battle. I would feel like I was going to battle. So this is like my war suit of kind of, which is probably not the right analogy at this time of the world, but basically, yeah, I had to kind of fight through those times and try and succeed and achieve because it is hard, but yeah, I'm very
Yes,
lucky.
it is. It is. Just want to validate my understanding here. So the trigger for you when you lose your work, this is where it motivate you to take the lead and change your life. So you take it as a crossroad and you take it for your advantage. This is how I understand it. Is this correct?
Yes, that is exactly it. Because there was times where I was like, let's just sell the house in England and go and live in the country and I'll never work again. And I remember thinking the idea of that sounds lovely, but in reality, I'm sure I'll be like still wanting to
No.
try. Yeah, no, it wasn't the right time to stop and give up. It was like the time to push harder than ever.
I feel you exactly, Jules, because that's what happened with me. I lost my job, and when I lost my job, I become on. It's the same scenario because my company they brought me to Canada, and when I came to Canada, I start work with them 2 years approximately, like what happened with you. Then they
Mhm.
let me to go. So I
Oh,
come here. It's a new country, a new culture, like what you have. So what I have to do? Come back or stay. Stay is
yes,
very difficult,
yes,
not an
yes,
easy. And I totally feel you. So you decided no. If I want to give up, I will not because for my son. I will not.
yes,
How I will be a role model for my son if I am
yeah,
in real exam? I got F there. I failed. So I take it. It's not easy. It's completely hard. So this is where I ask you this question because I felt it myself. Sometimes
yeah,
those big exam will take you for area you don't know how much you can do, and I can see it's take you further than what you are doing as a normal nurse doing her job. You start think about future, open business, bring leadership technique and philosophy. So all of those things will not happen if you don't have that tough exam. So this is where I feel this is personal for me, and I like to share this with you and with all
yeah.
my
Thank you for sharing.
audience. Yeah. So
And do
podcast.
you
Yeah.
Do you
Tell me.
find that you have to like because you're new and you try something new again, you have to kind of there's that proving yourself moment again. So I think that also helps us at this time to kind of grow even more because, we know what we are, but people don't know what you're capable of. So you then have to kind of meet a whole new group of people and show them what you're capable of and do your best. So you're going through the same thing of challenges and
Absolutely.
growth.
And the podcast, it came also the idea as I'm not looking to be a popular host. I'm not well not. I'm not looking for the likes and how many want to follow me. If you go for my channel, you will see it's it's very humble number, but it's motivate me to be closer from
Mhm.
those success leader where I not only telling their story, they charge me to keep doing what I'm doing right now. And
That's
also for
amazing.
the same thing for the new generation. And this is the question was I want to ask you. If I want to ask you, if only I knew for you what you will do different for your career.
If only I knew, I probably should have left my last job sooner. I was in my comfort zone for a long time, and that's absolutely fine for people to stay in a job for a long time and be comfortable. But the only thing, and I don't regret, but if it was one thing I had to do, I would say I should have left sooner to kind of. I can't imagine where I would be right now had I left a bit earlier and
No.
learn other skills and challenges and things like that. But again, this is how it was meant to be.
Interesting. And this is the point. Every time we are, and this is what happened with me exactly. I know the real the right decision to leave my job, but
Mm,
because I am stuck with all commitment and
yes.
I as you mentioned in the Western, I need to bring food to put food in the table. So this is all the expenses. You are from the Western, you know how much is expensive or way
Yes.
that what is in
Yes.
Emirates. So this gives me no, I have to stay. But I know the right decision. I need to go. I need to leave. And when this has happened, that was the sign for from the God. Go, don't worry. And that's what's happening right now. So sometimes we are afraid. We have that imposter syndrome. We don't know we are
Mm.
in it until we leave it. We thought we have the control, but we don't have the control for this. One of the things you mentioned here, you mentioned different patient came for you in your clinic, and I will not go for more about the business, but I want you to help us to, from your perspective, to compare the Arab country and especially the Emirate because it's considered one of the richest society in the Arab region, and with the England, how
Mm.
the patient, how the culture, the difference between here and there. And you have mentioned the different patient care from you, some of them rich, some not, especially the stereotype. Everyone in Emirates, they are rich, they are VIP, they are live in the Burj Al Arab, which is not the case. So tell me from you as a Western live in Emirates, how you see Arab country, how you compare the healthcare system in Arab country with your back home or with England.
I find that the UAE is just the most incredible place in terms of fertility, and the government is so forward thinking, and the leaders of the Department of Health and the royal family and everyone involved thinks so far ahead. And that's why there's so many advancements here. Financially, they support the population to go through IVF. So even that struggle being taken off people is truly amazing, and they can support for as many years and as many tries as they need to, which is just amazing because obviously they do want to grow the population and help the local population. So not only from that helping them financially, but in terms of bringing leaders from around the world wanting to do research and wanting us to build these 7-star facilities and really trying to push everyone out of their comfort zone to give the best to the population. I had to really, it took a while to kind of learn about the different ways and the different styles of IVF in terms of, it is possible to have multiple wives, and it is possible, you can't, you do donor eggs, and, surrogacy is just becoming legal now. So there's a lot of things that are done in the Western world that are not possible here. So
Mm.
it's easy to say to a patient in the UK or America, if you can't get pregnant, just use donor eggs. And obviously that's not even a chance here. So you see
It's not
these
an option
women.
at all.
Not at all. Which is hard because there is no other chance apart from trying. And then how many times can you try when normally you would say it's time to stop? And actually, on a psychological level, it's very difficult for women or families here because it is expected and wanted that you would have a child and you would grow your family. So I do feel for a lot of women here who can't, and to have to keep trying and trying and trying. So but it is honestly a fascinating and amazing place to be, and I cannot even imagine 10 years from now how what's going to be happening here. So it's the place to be for sure in terms of fertility.
So what's coming for fertility, what I understand from you, you see Emirates ahead of UK. and they
Mm.
more innovative and more investing came from
Yes.
the government compared for that.
Yes.
And this is for the first time for me. I know that I am Arab, but I don't know the Emirates they support the local for fertility because this is considered it's not necessity for medical necessity. This is the first time I know they still support them and give them the fund to do that, which is something interesting to know that.
Yes.
Thank you for sharing that. So this is where you can see it is the investment in the healthcare more way for from the Western. However, still we overlook the Arab country for the healthcare system because that's what I felt when I came here to Canada and I started
Mm.
working with the international company. I have high expectation. The Western they have a solid structure healthcare system. But when I came here and start as a patient, it's broken. Unbelievable.
I've heard about Canada. Oh my gosh, it's like all these stories coming out. It's bad. Oh my
It
gosh.
is. It is. So, Jules, I'm happy having you. I learn a lot from you, and I learn also a lot about the Emirates here. So, and this is the first time I hear someone like Abu Dhabi or Dubai.
I know, I know.
Yeah,
I think it's because I like the quieter life and I like to only drive 15 minutes to work and I don't want
yeah.
to have to travel because I was doing that in the UK. I was commuting an hour and a half each way to work. So I'm happy to, so that's probably part of it as well. But no, it's been so nice to talk to you. Very easy to.
Likewise. Any advice or comment or anything you want to share with the new nurses, anyone in the healthcare sector, not necessarily a nurse, a healthcare professional. They are maybe in the beginning of their career or in the
Mhm.
middle of their career
Mhm.
where they are struggling, burn out, frustrated, desperate. Anything to tell them with this nice suit?
I definitely would say, as tired as you are and as burnt out as you are, just do your best to challenge yourself, learn as much as you can, learn from your leaders. I think that there's so much opportunity, and I think the younger people do that, obviously, the better it is for them because you can progress a lot quicker. And if you can have the opportunity to travel to a different country, then definitely do it. I think it's just amazing as a healthcare professional to be able to go anywhere in the world. I mean, I still have my Australian and British and now UAE nursing registration, even though I'm not even nursing because I will never let these go because I think that what a precious thing to have and you can go anywhere and do anything. So take every opportunity and learn everything you can. They're my tips.
Lovely, Jules. I like your vibes, and I hope we connect again with your new clinics and have more insight from your leadership and operation perspective to learn more about your experience. Till then, have a good day and see you later. Bye bye.
Thank you so much. Thank you. Thank you, Anas.
Bye
Bye.
bye.
If this episode sparked something in you, here's how you can keep our mission alive. Subscribe to Uncharted Narratives Surdiyat. Leave us a 5-star review. It helps more amazing people discover our stories. Share an episode that moved you with a colleague or friend. Connect with me on LinkedIn and join our healthcare innovation community. Together, we're not just telling stories. Until next time, stay curious, stay passionate, and keep pushing the boundaries of what's possible in healthcare. See you in the next episode of Uncharted Narratives Surdiyat.